it's Shannon, and I wanted to document my breast cancer journey and my double mastectomy just for myself and just in case it would help anyone else out who's also starting this journey. So today is May 3rd, Monday, May 3rd, and I'm actually 6 days post-op for my double mastectomy. I had my surgery last week, Tuesday, April 27. I had a double mastectomy, nipple sparing surgery, and had tissue expanders put in. And so I stayed one night at the hospital, which I was so grateful for. There's just no way I would have been able or mentally prepared to come home the same day. Being able to be in the hospital with 24-hour medical care, nurses checking my vitals every few hours, checking on my pain level, helping me with pain medicine, and just being able to rest in that safe environment, I found really, really, really valuable and helped me feel prepared to come home and take care of myself. So stayed one night. I came home on Wednesday, so today is Monday following, and my recovery really hasn't been very bad at all. The pain's been manageable. I was prescribed a narcotic pain medicine, Percocet, along with prescription strength Tylenol and prescription strength ibuprofen. I did not need to take any Percocet by 2 days post-op. So the last Percocet I took was Thursday, 2 days after surgery, and I haven't needed one since. I've been managing the pain really well with just the ibuprofen and the Tylenol. They also did give me a muscle relaxer in case I have muscle spasms. I did not take any of those until last night, which seemed to also help me sleep. I found I was having a lot of muscle tension while I slept, which wasn't conducive to me getting really good rest. So, but other than that, I'm just taking the ibuprofen and the Tylenol, and then I'm also on an antibiotic just to prevent any infection. So I'm on doxycycline twice a day. So again, pain level has been very manageable. I think initially I did have some surgical tape, some gauze covering my stitches, which are right in the fold here under the breast, and so they had put some protective gauze on top of that just so that my surgical bra would not rub my incisions. But the tape that was holding on there, whenever I would get upright or stand up, initially I would just feel all this pulling on my skin, which was very uncomfortable. I wouldn't say it was super painful, but it was a little painful, but just really uncomfortable. But I did notice that after I had been upright or standing up, walking around for a few minutes, it went away. So I think my body was just kind of getting used to it, and then it would adapt, and then it wouldn't be painful anymore. As far as sleeping goes, initially I just bought a wedge pillow from Amazon, which I saw a lot of other women recommending, and I used that in my bed. I stayed in that my first night. The issue that I found was that I'm not to be using my arms to carry or support very much weight. So I cannot use my arms to push myself up when I want to get up. So all I have to use are my ab muscles. Well, even then, when you have this type of surgery, when you wake up and you want to bring yourself up, it's painful. So I ended up having my husband or my sister-in-law kind of push my back up to help me up, but it was still painful. And so my husband went ahead and rented me a power recliner because a lot of women said that the power recliner was really what saved them after their surgery. And so my husband rented me one for the month, and it's come in really handy. It's great just to sit in during the day, when I'm just kind of resting. I can't return to real normal activity yet, so I just kind of relax in the recliner, and having the power recliner, I can just push the buttons so that I can adjust things so that I'm comfortable. And I did sleep in that 2 nights, and I still find my bed a little more comfortable because I can spread out more. But the recliner helps so much when I'm ready to get up in the morning. I don't really have to use my ab muscles to pull me up. I just use the button on the recliner to get me upright, and then I can get to my feet with relative ease. So that's been a big help. As far as the drains go, I know a lot of people complained about the drains, said they hurt, said they were annoying. Frankly, I just sort of forgot about them. I didn't notice them very much in this first week. They are, I can show you here, I only have one drain left, but this bra has a loop on it, and the drain just gets looped here. Therefore, it's always on my bra, so I don't ever have to worry very much about pulling on it or sitting on it or it getting caught. I just kind of make sure it's, here on my body. So they haven't really bothered me at all, not to the extent that I have read about some other women really bothered them. And my husband was shown how to milk the drain lines and then empty the drain bulbs so that we can measure how much fluid my body is producing. The goal is for your body to, each drain, to produce 29 or less, I guess it's milliliters, and that's when you know that you can remove the drains. So my husband's been having to milk the lines, empty the drains 3 times a day since I got home. And I only have 2 drains, which was great because I thought I would need 3 because I had a lymph node dissection on my left side and then the mastectomy on each side. So I really thought I would need 3 drains. My surgeon said I may need up to 3 drains, but it ended up I only need 2. So I had 1 on the left and I had 1 on the right. And so my husband was taking care of that for me. And then today at the post-op, the right side, the fluid level had decreased enough that my doctor went ahead and removed the right one. However, the left one is still not quite there yet. So he left that one in, and we'll continue to check the fluid levels on that. And once the fluid level has reached 29 or lower in a 24-hour period for 2 consecutive days, that's when I need to call my doctor, and that's when it's okay to go ahead and remove this other drain. So ironically, these drains have not bothered me hardly at all. But today, since he removed the right one, it's almost like now that I don't have one on one side, I'm more aware of the one that I still have on the left side. So now it's kind of like, well, now it is kind of annoying because, I don't know, I guess maybe when I had 2 of them, I felt more balanced and didn't really notice them. I feel like now that I only have 1 left on the left side, I'm more aware of it. But again, I don't find them painful. I don't really find them that much of an annoyance. I think the annoyance is probably more for my poor husband who's, milking and draining these things 3 times a day, every day. I mean, God bless him. He's been incredible and he's been a trooper. But so, yeah, that's my feeling on the drains, in case anyone's curious about that. And then also regarding the removal of the drain, when my surgeon removed the right one at my appointment this morning, again, it didn't hurt. I know someone reported it just felt kind of weird. It didn't hurt. It took about a second. So my surgeon basically had me take 3 deep breaths, and he told me that on the 3rd breath, when I let that breath out, he was going to pull it out. So he talked me through the breaths, and then on the 3rd one, when he had me exhale, boom, he pulled it out. He said I might feel a little pulling. I guess I did. I don't know. It was over in a second, and it didn't feel a whole lot. So again, no need to fear the removal of the drains. At least from my experience, it was fine. He put a bandage on the drain site. So that was the drains. And then lastly, I have not been allowed to shower yet since my surgery. So I have not showered for a week. Some women, every woman's surgery is different. And so some women are allowed to shower 24 hours after surgery. So, it just all varies. Some women, like myself, they don't want us showering as long as we have a drain in place, because what happens is the drain opens you up to potential, infection because of the drain site if you, get something not good in there. And so I have not showered yet. I did purchase some sterile bathing wipes from Amazon, which have been fantastic. So I have been able to clean myself, but have not actually been able to shower. And I have been applying deodorant on the right side, which is, the side that did not have any lymph node removal. But because the left side did have lymph node removal, I'm very hesitant to put any kind of chemical underneath my armpit there. And also my armpit on the lymph node side, it's relatively numb. I don't have a lot of feeling in it, and yet it's very sensitive. So it's really odd because it's numb, and yet when I put the bathing wipe there just to wipe my armpit out, it's very, very sensitive. Like I can't hardly touch it because then it does hurt. So it's just kind of a bizarre feeling there. So I have not been really able to really clean that armpit well. And as you can imagine, when you haven't been able to shower for a week and you're going to see your doctor post-op, it's just, you're not going to be the most pleasant as far as your hygiene goes. But as a lot of people reassured me, try not to be self-conscious about that, because let's face it, these surgeons see this all the time and they're not thinking about your body odor or your hygiene, especially because they're the ones that are keeping you from showering, and all they're concerned about is keeping you infection free. And so they don't care about what you smell like. They just want to make sure that you stay infection free. That's the priority. And so, as someone pointed out to me in a breast cancer Facebook group that I'm in, she said the smell of an infection is a smell entirely on its own level that's way worse than the worst body odor. And so she said, trust me, the surgeons do not care about your body odor. They want to make sure you do not have an infection. So that really helped me to sort of get the self-consciousness off my mind, because here I'm worrying like, oh my God, I smell terrible. I have to go see him and his nurse. And thank goodness in this pandemic, everybody's wearing a face mask because maybe that will shield them from the odor. But anyway, so I think that is about my update for today. And again, I am about 1 week post-op. Tomorrow will make exactly 1 week since I had my surgery. And so just wanted to give that update for anybody who might be going through this process, maybe just got newly diagnosed. I know you're just overwhelmed with information and emotions and fear and anxiety. I know this surgery is what scared me the most. I mean, quite frankly, this surgery scared me more than the cancer did, because for some reason I knew we could get rid of the cancer, but I was worried about this process, and specifically having not only a mastectomy, but a double mastectomy. So I just want to reassure anyone out there that you can do this. You will likely make the surgery worse in your mind than it ends up being in reality, because you just simply don't know. You don't know what it's going to be like. So you imagine all these things. You're going to read a lot of comments and questions if you're in Facebook or other groups from people who may be experiencing complications. And so then that leads you to believe that, oh my gosh, I'm going to be going through all these horrific things. And if I could give you one piece of advice, it's to remember that people who are posting questions and comments in Facebook groups are probably only the people that are actually having an issue or a complication. The people you are not seeing post are the people whose experiences have been good, relatively complication-free, and don't have any issues, and they are out there. It is possible to go through this process and this journey smoothly with little to no complication. So don't let the people who are struggling, who are reaching out for help, make you think that that's how it is for everyone, and then that's what you're going to have to deal with. Because you most likely will not have to, but at least you're prepared and you kind of know, you know, the range of what you might expect, even though it's likely not gonna, you know, you're likely not going to experience anything that you can't overcome, and that will, you know, nothing that's worse than having cancer. So just keep that in mind. I had to remind myself that quite a few times. Don't let those posts build fear in you, because there's no need for it, and you really want to keep a positive mindset and visualize yourself healthy and that you're going to have a good outcome, because I think 80% of this is what's up here, what your mindset is, and keeping things positive. Don't focus too far ahead. Focus on the immediate next step and getting through one day at a time. Don't focus on what's coming down the pike, you know, a month or 2 months or 3 months from now. Just focus on the first step. And then when you get through that, you can focus on the next step. Otherwise, you're going to end up overwhelming yourself. So anyway, that's my update for about 6 days post-op for a nipple-sparing double mastectomy, and I hope you found this helpful, and I will make additional updates later on. All right, thanks.